Hello, this is Ron McCullough, consultant podiatric surgeon. So in this particular short video, I just want to talk about the time that is necessary to start thinking about changing your shoes. It's actually a fairly critical decision, and a lot of my patients have difficulties deciding or knowing when to do this. So the key point is that it is fairly useless to use criteria like the amount of time you've had the shoe or the amount of mileage you've done in the shoe, because that will vary hugely from patient to patient and shoe to shoe. Obviously, if you're a very light person, then you're going to wear the shoe out far less quickly than a heavy person, and it's also very dependent on the resistance of the shoe. I also think that wear patterns and things like that are not the key criteria. There are other things to look at, which I'll discuss in this video, which are far more important in terms of deciding when a shoe should be replaced. I always remember some years ago I saw an Arsenal player in our facility, and who had some knee pain, and we did various investigations using our advanced gait analysis systems, and it soon became fairly obvious why he had his knee pain. However, this person had multiple scans and investigations which had proven unfruitful in trying to understand why this knee pain was occurring on one side. So when we assessed him in his trainers, and it turned out that one pair of trainers which he used a lot outside of the club, so the club weren't particularly aware of this, was a pair of Nike Airs. Now, there's nothing wrong with Nike Airs, but in this particular case, this particular shoe had a small puncture. You couldn't really see by looking at it because the air looked intact. But when we did our gait analysis, that part of the shoe completely collapsed. And because he'd been training in that shoe a fair bit away from the club, that's why his knee pain developed. He had severe distortion of the shoe, which of course threw his knee in and caused his knee pain. And obviously a lot of things could have been avoided in terms of investigations, MRI scans, etc., if this had been picked up. In this situation, it's not really the fault of anybody. It's just one of those things because he wore the shoe outside of the club, and it could happen, and structural deficiencies could happen with any shoe. But therefore, it's really important to look at the shoe as a runner or even as a hiker or walker, and to know when you need to change your shoe. Okay, so before I go into the detail of that, I just wanted to show how different shoes differ in their torsional resistance. So the key thing is that after a while, a shoe will begin to twist out of shape, and then it becomes an issue because it forces the foot into an abnormal position. Now, that position could be inversion or supination, abnormal pronation. So the shoe becomes part of the problem. Usually the person has an underlying foot type that makes the shoe distort like that. But if you then don't change the shoe quickly, you'll find that the shoe becomes part of the issue and it starts to exacerbate the deformity. So in respect to the shoe, obviously, if you look at a shoe like this, which is a very nice shoe that we like a lot, it's the New Balance 860 version 14. This shoe is a little bit more of a responsive anti-pronation shoe. It has, good flexion. The flexion point is quite far back, but it does have a degree of, you can kind of twist this shoe in various positions. So its torsional resistance is moderate. It's not anywhere near as stable as some shoes, but it is very responsive shoe, and that's why it's the right kind of shoe for some people. So if we now look at a shoe like the A6 Cayano, and this is the latest version 31, this shoe is far stiffer. It's really hard to twist it out of shape, so it's going to take a lot longer for this shoe to lose its properties compared to the one that I just showed you. So the shoe is really important. Looking at wear patterns, sure, if the wear pattern has gone all the way through and you can't see the tread, it's time to change the shoe, but that's actually not the most important thing. The most important thing to assess in a shoe is torsional deformity. If you keep running on a shoe that has torsional deformity, you are very likely to eventually get issues and potentially become injured. Here we have the shoe I showed you earlier on. This is the New Balance 860. Now the first key thing is I've put this white sticker on the seam at the back of the shoe, but the seam at the back of the shoe, it can be your indicator. You obviously don't have to stick stickers on. We've done it for the video. So this line must be at 90 degrees to the ground, and you can see it's straight. It's not tilted into what we call eversion or inversion. It's straight. Okay. So and also the second thing is if I push on this shoe, it's stable. It wobbles a little bit, but basically it's maintaining its position pretty well. It's never going to be as stable as the A6 shoe I showed you earlier on because it's just not that kind of shoe, but it's pretty good. Okay. Now if we go to the A6 Cayano shoe, you can see here that this shoe also has a line at 90 degrees, so it's fine. We don't need to replace it. And if I press on it, you can see here even more, there is virtually no movement in that shoe as I try to push on the side. Again, it's not in eversion, it's not in inversion, it's straight. So this shoe again is okay. Obviously you can look at the wear, and if the wear's worn through, if the pattern has disappeared, the wear pattern, and you know you probably should replace it anyway. But this is a far more important test. Now the final shoe I want to show you is a shoe that has distorted significantly. Okay, so here you can see the line is no longer straight. For that line to be straight, the shoe would have to be positioned something like this, okay? But instead it's positioned like that. Not only that, when I press on the shoe, it has a real rocking action. This is a shoe that's distorted into abnormal pronation, okay? And what that means is that there's too much collapse of the arch and ankle, and it's forcing the shoe into a distorted position. Now it could be that the shoe is absolutely fine and it's just been worn for too long. In fact, this is a stability shoe. But it could also be that it's happened rather prematurely, in which case you would want to consider a shoe that is more anti-pronation than this one. Conversely, if the shoe is distorted like this and you put it flat and it's like that, then there is evidence that you have excessive supination. In other words, you're loading the outside of your foot too much, and as a consequence the shoe is distorting in the other direction. And if that happens, you need to think about getting a shoe that is stable but not anti-pronation, because an anti-pronation shoe will actually make it worse. If your foot's in that position, it will push you that position into this position more. So I hope that makes sense. I am doing another video which explains the fundamental structural differences between a supination and a pronation shoe. So watch out for that one. But in the meantime, do use these as your criteria for when you decide to change a running or a walking shoe, or in fact any type of shoe.